Sam, appreciate the introduction. So I'm Chris Murray. I'm a senior manager in our life science and healthcare practice at Deloitte. I'm also the go-to-market lead and chief architect for our MyRate Finder price transparency and pricing strategy analytics solution. I also co-lead our healthcare transparency practice. I grew up, like Sam, in revenue cycle, spent a lot of time in mid-revenue cycle, charge capture, coding, CDI, and naturally have a passion for analytics. The past 5 years, I've been spending time with healthcare organizations across the ecosystem, helping them design pricing strategies to really improve the economics of the system. And one of those systems or organizations I'm really excited to be here with is University of Washington Medicine. Close friend and colleague, Matt Lund, for UW Medicine. We've been working together for over 5 years, spending a lot of time poring over this type of analysis. So Matt, I'll let you give a quick introduction before we jump in.
Sure. Good morning, everyone. My name is Matt Lund. I'm the Chief Contracting Officer at UW Medicine here in Seattle. We're a 4-hospital system, or I should say 3-hospital system, 2 hospitals operating under 1 license in there. We've worked with Deloitte on pricing strategy for the last several years, finding great success and consistency, building a sustainable pricing program at UW Medicine as we've gone through with Deloitte, and working on utilizing some newly acquirable information as well, which we'll talk about related to machine-readable files.
Thanks, Matt. So it should be no surprise, pun not intended, that there are many new sources of pricing data that are emerging in the ecosystem at an accelerating rate. So for those that have been at this for some time, you'll even remember prior to 2019 when this curve was really below the line, and there was really no market data at all. We had some limited data set data from CMS. There were some blinded data sets, but really no understanding of what payer-provider prices looked like. That changed in 2019 with the first regulation to post hospital charge masters, and as we all know, that was not particularly helpful. What really changed things was in 2021 when we started to see with provider healthcare transparency, very specific healthcare prices illuminating what payer-provider negotiated rates looked like at a very granular level. In 2023, so where we are today, right, fast forward 2023, and we have an explosion of data. And we're talking, right, hundreds and hundreds of petabytes, more data than what's in the Library of Congress, right? And so that's created a real analytics spring for pricing strategy and other pricing use cases, which, what brings us today, which is really, the hard part, which is, what do we do with all of this data, right? How do we get to what's essential? How do we figure out what it means, right? How do we actually apply it? And we're doing that across, many use cases, right? So today we'll talk a little bit about pricing strategy use case, but we're also seeing, shopping use cases and shopping use cases across the different customers. So not yet, patients actually shopping using these machine-readable files, but we are seeing employers and payers starting to use this data to make shopping decisions around networks and products. So it's a really exciting time for the pricing space. I think we have a lot of work ahead of us. So we're excited to have this dialogue and answer questions around the use cases. Sam, back to you for some questions.
Oh, I appreciate the overview, Chris. Matt, I'm going to pick up something you said, or maybe Chris, you might have actually alluded to this, but it sounds like you guys have been working together for going on 5 years. Matt, I understand you guys have had a lot of organizational focus on pricing strategy for quite some time now. I'd love to know more about kind of the overall evolution of the program, and specifically, how has the access to new data changed what you do?
Mm-hmm. It's a great question, and I like your use of the word evolution because I think that really describes what's gone on. When we first engaged with Deloitte, we were operating with different hospitals within our system, each with different pricing strategies, different pricing processes, that while they were all reasonable individually, there wasn't really any kind of synergy between them, and really there was a danger of things kind of conflicting with one another. We also knew that, at least the word on the street at the time, was that there was going to be some pricing transparency going on, where those charge masters would be much more visible to the public, and we wanted to make sure that what we thought was a reasonable practice actually was when viewed together and by industry experts. So we engaged with Deloitte to go through a overview of all of our pricing strategies for all of our hospitals, and benchmark those prices against similar comparator hospitals across the Seattle area and the West Coast, to really test the reasonableness of our pricing, and then look for opportunities to improve incremental revenue growth where we could, and really build something that would be sustainable for continuing to manage our price setting process moving into the future, to both be defensible to any people in the public, particularly the people that we serve. We have public hospitals, and we want to make sure that we're doing right by the public as well, not just being reasonable, but appearing reasonable to anybody who's going to be looking, but then also to improve our ability to capture revenue where we can.
Oh,
yeah, I love that word sustainability, Matt, because you're right. I mean, I think what's important, especially for anyone in the audience that's thinking about starting a new pricing program, starting to look at this data and figure out how to use it, is you need to build a strong foundation. And what I really respect about UW is they took the time to build the org structure and the op model to be able to digest all this data and make decisions in a meaningful, sustainable way from the analytics. And so that kind of takes two pieces, right? First is an actual pricing strategy. And so like Matt said, for UW, that is the principles that they use to make pricing decisions, right? That they want to make sure that you have a fair price, right? That is consistent across the system. And then ultimately, these are profitable decisions that are going to be able to serve the customers or the communities, right, that they serve. And so in doing that, right, the data, what we're kind of all here to talk about, is like there's three important levers when we think about pricing strategy. There's value, which is I think we all agree is the most important, which is kind of quality, access, experience. You can look at Net Promoter Score. You can look at your CMS star ratings to kind of get a sense of quality. Then you have cost, right? Your unit economics and the cost structure and what's a viable price. But then this new really kind of exciting element, which is really expanding, is then market, right? What's the market able to bear? What's the market going to tolerate? And 4 years ago, we were using CMS blinded. Truven had a product. But it was very, very kind of high level. Now we're able to get super granular into what are the payer provider combinations that we can understand and really be able to see the market landscape and really optimize the value around the pricing strategy. All the points that Matt made.
Well, Chris, since you've got the mic, let me ask you this. I've heard that it's kind of the wild, wild west out there with these payer MRF implementations. Can you tell us a little bit about what that's been like?
Yeah, I would emphatically say yes. It's definitely the wild, wild west out there. And I was serious when I said explosion of data, right? And the question is why, right? Why is it so hard, right? Why is it so hard to extract data from these files? Why are they so huge? And I think on the question of why is it so hard, right? I think for those that spend a lot of time, I think many on this call do, it's not easy to report prices, right? We don't have the systems, we don't have the reimbursement methodologies, don't necessarily suit themselves to a machine readable file or Excel file. So it's challenging just to organize the data. But then also there's no incentive, right, to make these machine readable files that are for use for competitive dynamics and for aggregators to be user-friendly. So, ultimately what you get is a ton of data in a very unusable fashion. And so then we have the question of why so large, and let's just use some easy numbers to kind of start to understand the scale here. So for one provider, when we think about the provider price transparency reg, right, we're talking in any CDM, right, you may have 50,000 items and services, and that's across 100 different products, right? So now we're talking for one hospital, one MRF, maybe 5 million different, rate values. And 5 million, that's not that big for those of us that, work in analytics, right? It's, it might not be in an Excel workbook, but certainly easily manageable in a SQL database. So then let's talk about plan. Plan's a little bit different, right? Let's talk about that same provider, right? So we have 50,000 items and services, right? Supplies and pharmacy. And now you take 10 products. Now you have 500,000, right? For one plan, right? For one provider. Then you have a national network of 3,000 providers. We're now talking about 1.5 billion rates. And then they start repeating that over places of service. So now we have, let's say, 10 places of service. We now have 15 billion rates. And now that can be duplicated over NPIs, right? Sometimes a provider can have, in the MRF files, 10, 20, 30 NPIs over employers. Like now we're talking thousands of employers. So now you can easily start to see, right, how this starts to balloon into a database that's the size of the Library of Congress. And so, why is it important to kind of understand the scale? Well, that scale creates a lot of noise. And so we have a ton of data, right, a ton of noise. How do we get at the meaningful components, the essential of that? And I think, Matt back and talk about here, it takes a good team, right? We need to really be able to understand the data. You need a toolkit, right, of analytics to be able to normalize and mine for what's essential and then identify the trends in that essential data. And then you need a team that's really understands the market, understands the competitive forces and the reimbursement methodologies to be able to then interpret those trends in a meaningful way. We like to say, right data, right analytics, right assumptions, drive the right conclusions, and then action, right, and ultimately, get the value from it. And so, me and Matt spend a ton of time with our teams working through, very closely understanding the underlying data and interpreting what we're seeing and be able to throw out what, doesn't make sense and keep what's meaningful. And so, Matt, I'd love to, you talk a little bit about some of those critical success factors of our relationship and what our team's been spending so much time doing together.
Certainly. I mean, you used the term petabyte earlier, and I was joking with you the other day. I don't think I'd heard the term petabyte until we got into this process. In other words, there's just so much data that's in those machine readable files that to be able to get through that, you really do need the assistance of some experts, but in particular, all of the data in there, much of it is useful and some of it is really just noise, zombie data, as we've been calling it, that isn't going to be helpful. And of course, every plan, every payer that has posted has done so a little bit differently. And so working with Chris and his team, we've been able to sort of sift out the noise and get at what really is valuable to our system. And getting to that point to be able to actually see where we stand in the market helps us to be able to more coherently make our value case to our public. Precisely because we can understand where we stand a little bit more clearly against our competitor hospitals for different service lines, for pricing and cost overall. And it allows us to think a little bit more clearly with better strategic opportunities to be able to take different ideas to our market. One thing that stands out, in the work with Chris and his team is that there are different ways to review the data, obviously, but to have my team's view of the local market leveraged with Chris's team, the view of how they've worked with other similar systems throughout the country, really do help us to come to better informed decisions when we're using this data. I'll also say that over time, the data that has been posted has started to improve. You can imagine the different insurance companies, put only the bare minimum amount of data up on the machine readable file to start, and they've improved that over time. And so each time we look into the file, or Deloitte looks into the file they help us look at it, the picture improves a little bit to make it a little bit more usable.
Yeah, Matt and Chris, is it fair to say that the complexity that is the data set and the amount of hours and effort that go into this is somewhat streamlined or made easier through utilization of the MyRateFinder product or tool? I mean, is that helping normalize data, or at least ingest and deliver insights?
Absolutely. Without that help, we would not be able to compare apples to apples. I can only imagine the situation we would be in if we had tried to crack open that file and really tried to do it without the help of subject matter experts. It really does help to get us to a place where we're able to utilize that information, compare it across different companies, and put it into use right away. And so it really helped to sort of bend time to be able to work with Deloitte and the MyRateFinder tool to be able to do that.
Oh, that's awesome. Matt, and I know we're running out of time here, but if you can leave the audience with one pearl of wisdom on, I'm sure we've scared off half of the crowd here, but if there's a way to make how do you get started? How do you launch? I assume people are probably dealing with all this complexity and all this data and trying to figure out just where to get started. Maybe you can offer a bit of advice on that front.
Well, I think curiosity is a good place to start. I suspect that every single person out there listening who has a job similar to mine has always been curious as to what the reimbursement rates are for your competitors in the area. It's always been an undefined, undefinable variable. Really, it's come down to a lot of hunches. We think we're paid more or paid less than a certain hospital system or something. That curiosity, I think, in filling in, everybody who does contract negotiation, for example, understands the value of understanding the market, and this really does help to define that variable. And I think that sort of figuring out how that information might help you make progress for your system is a great place to start, and then finding a partner that can help you make sense of all the information that's out there. As Chris said, really the transparency efforts were perhaps nominally intended to help individual patients, but really what has happened with these regulations is that it's created this huge pool of data that's intended to be analyzed by groups that can process big data. And that's exactly what we've got with Deloitte's help.
Excellent. Matt, Chris, thank you so much for your time. Much appreciated. Love hearing your vignettes and stories about what you guys have done in this space.